These videos will demonstrate what exercises to carry out following your hip replacement surgery. It is recommended to start these exercises from day 1 after your surgery. You may feel a degree of discomfort when completing these exercises, which is to be expected. If you feel any exercise is too painful, please discuss this with your physiotherapist after your surgery. We suggest completing each exercise 10 times and repeating the sequence 3 times a day. Continue with these exercises for 6 weeks following your surgery. After 6 weeks, once you have been reviewed by your surgeon, you may be ready to progress to more challenging exercises. Please see a physiotherapist to assist you in progressing to the next phase of your rehabilitation. Try and straighten your knee as much as you can, pushing the back of your knee into the bed. Pull your toes up towards your face. Hold this for 5 seconds. So you should really feel this muscle up here working. And then relax. Perfect. Then just relaxing down again. Is that okay? Bend up the hip and the knee, keeping your heel in contact with the bed. And back down again. You can place a plastic bag under your heel to make the exercise easier. Yeah, that's perfect. Great. It's a good bend, and then you're going to straighten out again. We'll go once more, okay? So sliding up. Great. And back down again. Yep, really good. Well done. Place a rolled up towel under your operated knee. Keeping the back of the knee rested on the towel, squeeze the thigh muscle while you lift your heel off the bed. Pull your toes up towards your face. Hold this position for 5 seconds and slowly lower the heel down. Excellent. Lying on your back with your legs straight, pointing your toes towards the ceiling, slide the operated leg out to the side and back in. If required, place a plastic bag under your leg for this exercise. Well done. Yeah. Straighten the operated knee out as much as you can, pulling the toes towards you as you do so. Really good. Great. And again. Hold for up to 5 seconds. Slowly lower the leg down. Stand straight, holding onto a chair for support. Move the operated leg out to the side and back in. Your foot should lift off the floor as you move it outwards. Rest your foot back on the floor before you repeat the exercise. Perfect, that's great. Stand straight, holding onto a chair or the kitchen counter for support. Move the operated leg backwards, keeping the knee straight as you do so. Move the back leg to the start position, resting the foot on the floor before you repeat. If you would like to book an appointment with the physiotherapist here to support you with this programme, please contact us at outpatientphysio@matterprivate.ie.